All right, guys, let's get busy talking about our disorders of deception. We'll start out by talking about factitious disorder, also known as Munchausen syndrome. And this is characterized by intentional deceptive behavior related to made-up medical complaints. So this is falsification of disease signs or symptoms. An example could be someone who presents to the ER complaining of abdominal pain, even though they have no abdominal pain. And this motivation reflects an unconscious desire for attention in the form of medical care or procedures. So these people get enjoyment or satisfaction out of the attention they receive from the doctors and the nurses and the techs who are working them up and doing procedures on them. It's important to note that this is not motivated by external rewards. So I'm actually going to highlight that in red because it's so important here. So external rewards would be things like financial compensation or time off work. These people are coming to the hospital because they want attention. They like the activity of jumping through all the hospital hoops and going through all the procedures and getting their blood pressure taken. They like that attention from the healthcare staff. They are not there for financial compensation or to get off work or to win a lawsuit. These patients just enjoy going through the medical process. Another important thing is that these patients will willingly accept unnecessary or invasive procedures. So if you told this person, I'm going to have to put an IV to get some blood work, they'd be like, here you go, here's my arm. They love it. They can't get enough of it. So that would actually be encouraging them and reinforcing their behavior. Also, this tends to be more common in women or healthcare professionals. Healthcare professionals, you might classically get a question about a nurse who's working in an ICU and she is purposely feigning symptoms of like diarrhea by taking laxatives that are making her have diarrhea, so she gets further attention by the medical workup that she receives. And these healthcare professionals tend to be better at doing Munchausen syndrome because they know the interworkings of the hospital system. So they know what symptoms to make up and how to report history in order to get more procedures done and more thorough workup and thus more attention. Now, let's move on to talking about Munchausen syndrome by proxy, also called factitious disorder imposed on another. And this is essentially the same. It's just that the factitious disorder is going to be the product of somebody else. So classically, we think of this as a mother who is submitting her child to extensive hospital workups, making up symptoms for their child, or a caregiver who is fabricating illness or symptoms for an elderly person that they take care of. So this is exactly the same as factitious disorder, except the parent or caregiver fabricates an illness for a child that's elderly, and this is considered a form of child or elderly abuse. Now let's move on to talking about malingering, which is going to be easily separatable from the previous two conditions because this is all about external gain. So previously, the motivation for the Munchausen syndrome or Munchausen syndrome by proxy was all about the attention that they seek through this hospital or healthcare process. Whereas with malingering, these people are seeking something objective or concrete outside the hospital system. So this could be compensation lawsuits or avoiding work. Those are two classic examples. So the history, the symptoms, and the problems are intentionally fabricated, just like in Munchausen syndrome. However, these patients have a very distinct goal. Another cool key difference to point out here is that these patients have poor follow-up with treatments. So unlike the Munchausen syndrome patient who's like, here's my arm for the IV, like I want an IV because I like the attention, patients who do malingering, once they get their external gain, they're like, no, I don't want more any tests, I don't want to do any more appointments. Once they get the thing that they want, they are gone. They're like, see ya. So the deceptive behavior ceases after completion of secondary gain, and that's a great way to differentiate malingering from Munchausen syndrome.